We made it. Oh my gosh. Sorry, guys. Technical difficulties, but we're here. So, can everybody hear us? I guess we should just make sure. Let's look at the chat. Can you guys hear us? Oh, it says no audio. Can you hear us now? Oh, somebody raised their hand. Thank you so much. Good to go? Okay. All right. Thank you. Sorry for the technical difficulties. Um, as I am approaching middle age, or as I am middle age, Dr. G,
I'm more than middle-aged.
we are relying on our wonderful young colleagues here to run these things. So thank you for your patience. A lot of you by now have met Dr. G.
Hi, everybody. Yes, this is one of maybe my third webinar that we
Third
get to share.
webinar.
Yeah, but it's more fun that we get to share one today.
We're doing it together because we just thought it'd be fun. We are all here at Clear Dermatology so excited about our new technology, and I know we've been talking to a lot of you guys about the Ultra Clear. This is such a crazy, exciting um, technology, and we can't wait to tell you about it. In fact, Dr. G and I were fighting over who is going to make the slides, so we both made slides, and we're both going to talk to you. But I want to tell you, Dr. G and I are putting together materials for our protocols, aftercare, etc. And I was texting with a colleague, and I'm like, "Hey, I just got the Ultra Clear." And he's like, "Oh my gosh, I'm so jealous." And that was the sentiment amongst a lot of my colleagues that I was texting in the cosmetic dermatology side. So I just feel so fortunate that we can share this technology with you. So, what is this Ultra Clear? We're about ready to tell you. So, I'll have Dr. G start.
So I saved this nasty question for Dr. L to be a surprise, but were you good at physics?
Yes.
I wasn't, so I don't know why I'm in charge of presenting the physics. However, I'm going to present. That doesn't surprise me at all that Dr. L is really good at physics, a very analytical mind. But we're
But I am definitely
gonna
not up for a pop quiz. So that's as far I'm just you're just gonna have to take my word for it. And in fact, I was telling my son that a 16-year-old or 15-year-old that I was good at physics and he didn't believe me. So please no pop quizzes, Dr. G.
no pop quizzes. And actually, I think that there are certain things about physics that are really fun to learn about, especially when you hear about laser. Like laser has this mystique about it. So we're going to do lunchtime laser. Just really quick, because I think it helps everybody understand a little bit more about what we're talking about. And you know that at Clear Dermatology, our goal in webinar is really education. We want you to be able to lean on us for true, honest education about anything in aesthetics. And so we're going to get started with just a touch of physics. So this is like a fun little picture that kind of shows how a laser works. So lasers are full of mirrors and atoms, just very basic aspects of physics, and jump in anytime, physics expert Dr. LaTowsky. The most important thing is that a laser beam is created such that these packets of energy called photons are all basically the same. And that becomes sort of important. So these are these like magic cosmetic packets of energy called photons that are created inside the laser, and they're what's called the same wavelength. And we can get back to that because we're going to talk about the wavelength of the ultra clear, but this is just an overall. So what's really important here, and I want to back up and explain something that a lot of patients ask me about laser. There really is not one laser that can do everything because the photons that are all the same wavelength, they like different things, like us. Like I don't like physics. But some photons like brown pigment. That means they treat brown pigment. Some photons like red, like little blood vessels that you see in your face. And we're going to talk about that in 1 second a little bit more. And some photons like water. This is a little bit more of a concept that's a little bit looser, but water is like wrinkles in the skin. So photons that are attracted to water will treat wrinkles. So again, I pulled a little picture of a shopping mall because that's what I like better than physics. And this is why lasers are not one-stop shopping. So we don't want you to get disappointed, like, oh, these red spots didn't go away if you pick a laser that's attracted to water. However, very important point. That's why I actually love clear dermatology. That's why you choose clear dermatology because we have a lot of the different lasers. I think as much as anybody or more in the Valley, you can speak to that. And I'm really proud of that. I know Dr. L is. So for instance, if you look at your screen, we took some pictures. Dr. L made sure they look beautiful. Our V-beam likes reds. So if you have reds, the V-beam is going to be great for reds. Our Fraxel, which we'll get to that in 2 seconds, the Fraxel likes water. So it also likes browns too. So it's good for pigment and wrinkles. The IPL likes browns and reds, but a little bit less water. Also, the IPL doesn't really fall under the category of a true laser, but that's okay. We'll call it that. So, one more little lesson. This is very important because the ultra clear is what's called an ablative laser, and the Fraxel is what's called a non-ablative laser. So we have this cute little picture here showing arrows. Imagine the arrows are these magic photons. It depends. An ablative laser, the photons actually pass through the epidermis and actually can make a tiny little beautiful channel in it. In a non-ablative laser, it doesn't channel through the epidermis. So there's no channel or change in the skin in the epidermis. It sends signals. I still think it's kind of magic. It sends signals deep into the dermis and works at the cellular level, talking to the browns and telling them to get out of the skin, talking to the collagen, fibroblasts, and telling new collagen to be made. Let me repeat one more time. The ablative does those things as well, but it does cut and make a little channel into the epidermis, which can be important for treating the wrinkles. So, if you want to know more about the Fraxel, which we're not going to talk about today, Dr. LaTowsky already made an amazing video about it, and you can watch it on YouTube. I believe that our great team here is putting it in the chat. Yep. So if you look in your chat, you can take a quick look, and you can, if you want to find more about non-ablative, which would be the Fraxel, you can go there, but we're going to continue on and talk about our new prized possession. So do you want to talk a little bit about what ultra clear? Or do you want me to talk about it?
Go ahead.
So this is a video of me actually performing ultra clear. So ultra clear, you can see it creates these small little channels that go through the epidermis. There's a little up close here in a stamping pattern, and it's what's called an erbium YAG laser. That means all the photons are erbium YAG. And you can see here me treating the neck on one of our colleagues. We're going to show you a picture of her in a little bit. And what's important to see here actually is that the treatment is pretty quick and it's also fractionated, which means the little pixels. So you can see it's laying down in tiny little dots. And if you have any questions while we're going, you can ask any questions. We'll stop and answer them. But this is an example of an actual treatment with an ultra clear that I did for one of our colleagues. And if you have questions specifically, we're going to get a little more into the details about it. So like I said, it's advanced erbium YAG ablative technology. This is one of my favorite things. I call it the snow. It's a special sparkle that you actually can treat a little bit off the skin, and it's like a magic wand that blends in everything. And we're going to talk a little bit more about blending because I know that's a fear that many people have about ablative technology, is that you could have a demarcation. So I just wanted to show you a few things. It's fractional, meaning it lays down as a stamper with like a little tiny holes in the skin where new skin's going to grow in, new collagen and pigment's going to come out. And then we can also use lots and lots of settings like this magic wand setting. It's really called Glide, but I call it magic wand. And one of the things that's really cool about the Ultra Clear, it literally has an unlimited number of different settings, which lets us treat you very, very uniquely. So no two treatments are likely to be the exact same. And if you tell us what's bothering you, we can drive the Ultra Clear to a very unique, personalized way to make you happy. Okay, back to Dr. Al.
Thank you so much. And I think Dr. G brings up a perfect point. One of the things we really pride ourselves on here at Clear Dermatology is that we are not a simple recipe. We don't follow simple recipes. We are a personalized medical clinic, and we are going to tailor your treatment for your specific needs, wants, and your biological needs too. So, one of the things that is so appealing about this laser, as she said, is that it's so individualized, and we can use this really, really advanced software within the laser to not only give you a safe treatment, but an individualized treatment based on your physical findings and your goals. So that's the number one thing with this laser, and that's why we chose to make this investment. So, um, again, we have, as Dr. G said, we have a lot of lasers and we can do a lot of things. And a lot of you guys have benefited from that. You've got reds, we treat them. You've got browns, we treat them. We've treated your wrinkles with Fraxel. We've improved your skin health with Fraxel. We've got microneedling, RF microneedling, etc. So why do we need another device? And why this device? So, as we hit upon the versatility of this device, um, we can treat all these things listed. So, fine lines, but also deeper wrinkles. And we'll talk about that in a sec. Pigmentation, this device is great for scarring. So, actually, not only acne scarring, but surgical scarring and burn wounds as well. Um, we can treat age spots, as I mentioned, sun damage, texture, pores, laxity. We can do that all and we can customize your treatment all with this one device. So with UltraClear, one of the things it really focuses on, and one of the things that attracted us to this laser is these stubborn lines, or the stubborn lines around the eyes. So this device can really safely tighten this area. So not only crow's feet area, but these really stubborn lines underneath our eyes on the inferior eyelids. And we can also get some lid lift with this laser by all the skin tightening it does. Similarly, we can do those stubborn lines around the mouth, the barcode lines, the smoker's lines, perioral lines, same thing. These things are super tricky. They drive patients nuts. We have good things that we can use to treat them, but nothing is perfect. And this is one more advanced step that we can use to treat these, and we're going to have really great results with these lines. Also, one of the benefits of this treatment is that it's got reduced downtime and reduced pain. That sounds pretty good, doesn't it? And that's because it's a newer technology. So the company likes to promote something called cold fiber laser technology. You'll see that in the media. They use that a lot for marketing. But basically, the technology is such that it generates less heat during treatment, which makes it a lot more comfortable during treatment. And that translates into less downtime. So, that, of course, is going to mean a faster return to work, less interruption in your social life. And again, who doesn't want that? But we're not compromising your results. Usually it's a trade-off. We do a lesser laser with less downtime. We're going to do less results, but maybe do more of those treatments, but not with this laser. So we have several different levels of treatment. And again, this is all very customizable, but for ease of scheduling, pricing, and then just learning about this treatment for patients and staff, we have separated these treatments into different categories. So there's a 3D miracle treatment. And again, this is registered by the company. So you'll see this in a lot of marketing. That's your lunchtime treatment. We also at Clear have a separate category called superficial. So we've got this very, very easy lunchtime treatment. And then we've got a light treatment, a moderate treatment, and a deep treatment. And when you're looking at these downtimes, as someone who's done cosmetic dermatology for 20 years, I'm going, wow, 1 to 3 days for a moderate treatment, 3 to 5 days for a deep treatment. That's pretty impressive. That's something that I have never really seen with an ablative technology. So this is something that really stands out with this laser. Less downtime, but you still get great results. And you'll see at the very bottom of this graph or of this chart, traditional fractional CO2, we're talking 1 to 2 weeks of downtime. And then I usually see 2 to 3 weeks of redness after that. You can cover with makeup at that point, but it's a pretty significant downtime. And sometimes the results are not as impressive when you consider the downtime along with it. That's why until now, we've never had a fractional ablative technology at Clear. Okay, so again, you'll see customizable. This is a theme that keeps coming up. We're going to make this treatment especially for you. And we're going to use our experience and expertise to plan your treatment and your input as well, because again, it depends on your goals. Um, what makes this possible, again, is a sophisticated software. So this is not a new earth-breaking, earth-shattering, groundbreaking wavelength. This is new technology that makes this safer, less downtime, and more versatile. Um, and we have the whole spectrum of treatments. And we also, of course, take into account your skin type and your tolerance for your downtime, your schedule. We can treat all skin types with this, believe it or not. So even those darker skin types, yes, we're going to adjust the settings. Yes, we're going to be very careful, but we can treat dark skin types with this laser. So we love that. We talked about the treatment being more comfortable. So again, we have a laser that's safer, faster, and easier than traditional ablative lasers. All right. So again, here is how we classify these treatments at Clear Dermatology. We have the 3D Miracle. This is your lunchtime treatment. This is the treatment that our estheticians are performing in the office. You are going to have 1 to 3 days of social downtime, and honestly, probably more on the 1 day spectrum. It's going to address sunspots, texture, fine lines, and pores, similar to a Clear and Brilliant, similar to a Resurfix, but more of a result and equal or lesser downtime. Then we have the next level up. We have a light treatment. This is going to be 3 to 5 days downtime for most people, more like 3, but I'm going to say 3 to 5 days. And we're going to do the same thing, the sunspots, the texture, the fine lines, the pores. But because it's a little bit of a heavier treatment, we're going to get more of a percentage, a higher percentage of improvement with this treatment. Next, we have a moderate treatment. So now we're going a little bit deeper. We're doing multiple passes in some areas. We're looking at laugh lines. We're looking at any little acne scars. We are customizing the treatment for your face, but we're treating different parts of the face differently. And we're doing an overall more aggressive treatment for you. So we're going to say 3 to 5 days downtime, but maybe more like 4 or 5 days-ish. You're going to have everything that I've talked about above, but with an even higher percentage of improvement. Now, this is where if someone has more sun damage, if they have some precancers, if they have a lot of sunspots, or if they have scarring, then we're going to use this treatment. So we're going to get an improvement in your skin health. We're going to get an improvement in your sun damage with this treatment. And finally, advanced. This is about 7 days of downtime. It's going to be a little bit less for some people, a little bit more for some people. But let's say about a week. So same downtime as a Fraxel, but it's going to be a more aggressive treatment, to be honest. We are going to really focus on the areas around the eyes, the areas around the mouth, maybe some deeper scarring, and we're going to get a more dramatic improvement. So that is how we have the whole spectrum of results at Clear. And again, it's kind of a spectrum because this is so individualized for everyone. But this is how you can think of the results. So the 3D Miracle, that's your lunchtime, then light, moderate, and advanced. Okay, so here's 3D Miracle. Here's your downtime. So on the left, you're going to have the baseline. In the middle, you're going to have 2 days after treatment. You can see that's going to be, there's hardly any swelling. There's a little bit of pigment change as the pigment is improving, but really, this is not a very dramatic downtime. You're going to get a little bit of exfoliation and sloughing, but by day 3, you're pretty much back to normal. You can cover with makeup. Here's before and after. So you can see an overall brightening of the skin. You can see an improvement in pigmentation, especially in the cheeks and nose. You can see just overall, this patient looks younger. The skin looks healthier and smoother. So this is 1 month after one treatment of the lightest treatment with the Ultra Clear. Here's an example of a patient with darker skin tone. You can see the improvement of the texture of the skin. This patient had some larger pores and some pitted acne scarring. So this patient had 3 treatments probably for the acne scarring, and you can see a really nice smoothing of the skin afterwards, but also look at the glow of the skin afterwards. It's just amazing. That skin looks so healthy and so young in the after picture. Here is my amazing, beautiful medical assistant. And she, you can see, had a light treatment. So one step up. Immediately after the treatment, you can see she's red, she's puffy. But even 1 day later, 24 hours later, you can see she could work in that condition. She could go out in that condition. She's applying makeup at that time and covering any redness. Already, she's back to normal. And this is a light treatment. This is not the 3D Miracle lightest lunchtime treatment. This is the light treatment. And here's her before and after. This is only 10 days after, so she will continue to get improvement as her collagen regenerates. But you can see the beautiful glow of her skin after treatment. And we'll show you later as we collect her before and after photos, but we specifically did some spot treating on some scarring and a dark spot that she had. And so as she gets more collagen, we'll show you some close-ups of the improvement she had, but you can see from a global perspective, she's got a beautiful change already. So this is our lovely, lovely nurse Maya, and Dr. G treated her just last week, and she had an advanced treatment. So this is pretty much as advanced as we get because Maya just wanted to go for the gold. So you can see day 1, she's pretty swollen, very, very swollen. So you may not want to go to work like that. Day 2, it's already looking pretty better, or pretty much better. She may be able to put a little makeup on that, come to work. And let's be honest, she worked through all of this. So, but the sort of average person with the, non-medical job. And then day 3, definitely you can go to work. You can start thinking about doing some stuff socially. Look at day 4. Like she looks so good considering the transformation from day 1 to 4. And again, for ablative resurfacing, this is just completely groundbreaking. Both Dr. G and I and Maya were like, wow, we cannot believe how quickly she's
Can I
back to
make a
normal.
quick comment about that?
Mhm.
I wanted to piggyback on something that Dr. L said. There are other erbium YAG lasers out there. And I want to just make a quick comment about that as well. Erbium YAG is one of the oldest cosmetic laser treatments available. And we all, Dr. L and I both have a lot of experience. I have over 10 years with a different technology using those same photons, though. One of the things that really struck me that I want to drive home about this newer technology, I truly believe that the trade-off for downtime and outcome is unparalleled. So that's one of the things that we're trying to show here. If you look at the day one pics are actually very similar to what I've seen with other fractional erbium YAG technology. Weigh in, Dr. L, if you feel differently. But I think because of the customizable aspect, the cold laser technology, the advanced way that this is delivered, the downtime truly is less. And calmly, that will equate to outcome. You're giving up outcome. Now, in our different levels, right? So from the miracle to advanced, the downtime may be different and you're trading that out for outcome. But when you're looking at Erbium YAG as a whole, I think that this technology is really special in this way, and Maya's photos really show that.
Thank you so much. Okay, so this is another patient of Dr. G's. In fact, do you want to talk about this a little?
Sure.
Okay.
So this is another patient of ours at Clear, and what was really bothering her was again around the mouth and around the eyes, tired appearance. There she is before treatment, and then at day 3, she actually looked quite a bit worse day 1, but she again this fast healing, and we just talked to her recently. Today is day 10 for her, and she's like, the big thing for me, my skin feels so much nicer. So again, I was astounded at how quickly. I want to drive home. This is not the final result. Collagen can take a little bit of time, although I think she's showing some really early results. And like our other patients, we'll continue to follow along for before and after.
Thank you. All right.
Oh, yeah.
So, yes, and Dr. G also treated this patient with an advanced treatment. And then day 6, you can see she's basically back to normal, doing her normal social
And
things.
she went to Pilates this morning, day 6, and she said everyone at Pilates was like, "Oh my goodness, your skin looks amazing." So I think that day 1 is important to look at. That's a little bit like what the previous patient looked like day 1, but don't fear. And we're going to talk a little bit about how we walk you through the process and make you feel confident throughout the whole process.
All right. So these are a little bit more of long-term before and afters after the collagen has kicked in and we see that tightening. Okay, so here's an advanced treatment. This patient had 3 treatments. I want you to know 3 treatments, so more than one treatment, but look at the improvement in the sunspots, in the skin health. So look at her glow in the skin. Look how much more youthful the skin looks. It looks more alive. It doesn't look so dull. And then look at the fine lines. Of course, it's not perfect, but that's okay. It doesn't have to be perfect. And we have other things that we could use for the remaining lines. But this is a dramatic improvement for a technology that's so quickly back to work and safe. And again, another patient post 3 treatments. Look at the health of her skin. So much healthier. It glows. It looks youthful. The texture is amazing. The brown spots are, for the most part, gone. And look at the improvement, especially kind of around to the side of her mouth. See all those lines that have gone away, and the remaining lines, more the expression lines, are a lot softer, and the whole area looks smoother. Couple more patients with moderate to advanced treatments. Both of these patients are post 3 treatments. We took these pictures from the original publication. So the way they were treating patients was pretty standardized, and I believe each patient got 3 treatments. So we'll let you talk a little bit about pain.
So I was surprised to hear how not painful this is. I'm, and again, with all the experience with Urban Miag, I think lots of Erbium treatments can come out great. It's just the experience you might have during the treatment. So it's actually Maya who said, this is the most comfortable laser I've ever had. And I think she's experienced quite a few. And other patients have said, I feel really good about this healing process. And we will come back to the process that we use at Clear Dermatology a little bit more. Another reason why you choose experts who are going to help you through the process and try to minimize risk. So, for our pain management, an hour and a half of topical anesthesia. It can feel kind of hot immediately post, so we work to cool you down. Resolution within a few hours of that hot feeling that evening should feel fine. Swelling and redness, depending on your level, right? So you'd have to go back to thinking about what you decided with your provider as your unique treatment for how much downtime you could tolerate. And we do monitor your selfies. So the reason we have those pictures of those patients day to day that are not in our office is because we look at your photos daily and we can explain to you more at your consultation how you would send them to us. But it's not 100%, but it's the best way for us to monitor you every single day to make sure that you're healing well. There's nothing that we need to look into further. Watch for any early signs of anything that might need further attention. And it's just high level expert day to day care every single day. Even if you're not in the office, we're thinking about you and making sure that you're healing in the best possible way.
And that really is something we pride ourselves on, the way that we take care of you. We take care of you like you were our family member. And as far as I'm concerned, you are our family member. And we are going to be monitoring you closely and making sure that you heal safely and properly. Okay, so kind of along those same lines, risk. So, risk for any laser, infection, scarring, risk of pigmentation changes. So, how do we combat these risks? And by the way, the risk for ablative lasers is traditionally the highest for any laser. So that's why they invented, about 20 years ago, actually, that's why they invented the fractional ablative to make the laser and the technology more safer. And now this sort of next level ablative fractional technology is even safer than um, those first tier lasers. So infection, we prevent infection with antibiotics, antivirals, and very detailed aftercare instruction. And we monitor your photos daily so we can check for any risk of that. Another risk of ablative technology is changes in your pigment or scarring. So there's a lower risk with your treating medical provider who has experience and who is using a safe technology and who's following up with you. And that's what we really pride ourselves on. This new technology, like I said, equates lower risk. And that's one of the reasons we're willing to make this investment. And then traditionally, ablative devices can have a demarcation in areas of treatment. You might have seen friends who have sort of like this line, and one part of the skin looks white and the other part looks a little bit darker. And that's something that the older generation ablative lasers can do. We're not seeing that with this laser. And like Dr. G said, we have ways of blending the treated areas so that we don't get that area of demarcation. So these are some of the ways that we are addressing these risks to dramatically decrease the chance of them. Okay, guys. However, this is your trade-off. This is not a discount laser. So if I ever see any of you going to Groupon for one of these lasers, I'm going to come pull you out of that office myself. This is not a Groupon laser. It is, it is a pricey laser, but again, you're trading safety and results for this technology. Okay. Thank you for hanging in there and tuning in and dealing with all our technical difficulties. So here are our promos. We've got three levels for you. Promo one, promo two, promo three. So number one, this is your easy one. This is the lightest one. This is for someone who just wants like a glow, wants to try the new technology, maybe wants something a little bit more than a clear and brilliant, definitely more than a microneedling, a little bit more than a resurfax. Level one is your lunchtime 3D miracle treatment. Remember, the downtime for the face is 1 to 3 days, probably 1 to 2, but let's say 3 just in case. It's a little bit longer for the neck, a little bit longer for the décolleté. So we're going to offer you face, neck, and chest for the price of $1,550. Normal is $1,900. This is a 25% savings. This is going to be done with one of our three estheticians, all who have experience with this laser. And we have, because of availability, we have 10 of each of these packages. So this is a great, great option. And I'm actually thinking I need to have this done ASAP.
I was thinking the same thing.
Yeah, I'm going out of that, looking at that, going,
Yeah.
okay, I'm gonna sign myself up for this. Okay, next, level two. This is going to be done by Nurse Maya or one of the MDs for you. This is a moderate treatment, full face. It's going to address scarring, moderate scarring. It's going to have 3 to 5 days of downtime. It's going to address some mild to moderate lines. It's going to give you a glow. It's going to help your sun damage. It's going to help your skin texture, pores, etc. $2,000. Regular is $2,500. So you're getting $500 off. And this is with Dr. G. This is with me. This is with Dr. Yonan or Maya. And we have 10 of these available for you. Finally, level three, this is the advanced treatment. So these dramatic downtime photos, even though they only lasted a few days, these dramatic downtime photos with the puffiness, that's this one. But I want to tell you, this is great if the lines around your eyes are bothering you. This is great if the lines around your mouth are bothering you. This is great if you have scarring that is driving you crazy. This is a great, great treatment, and you're going to get probably the biggest bang for your buck here. So full face, $4,000. You're saving $500, and I want you to schedule a good 7 days of downtime. Before all of these treatments, you need to stay out of the sun for 10 days before, 10 days after. If you go out in the sun to run an errand, you're going to wear a hat plus sunscreen. You're not going to go to the Phoenix Open within 10 days of this treatment. You are not going to go to your kids' all weekend long soccer tournament within 10 days of this treatment unless you are just really strict about sitting in the shade. So 10 level threes available. You can purchase these today or tomorrow. Level one, level two, level three. Easy, moderate, advanced, and please plan your downtime appropriately. We're happy to have a consultation with you sooner. If you're not sure and you think you want a level two, just book the level two. We can always upgrade to level three or downgrade to level one if we need to. And, you get a credit or you can pay the difference as we go. But for the promotion, you do need to book just because it is laser season and the schedules are a little tighter this time of year. I do have slots open on my schedule, as does Dr. G, as does Dr. Y for this treatment particularly. So you can get in before the sun starts getting more intense. And I believe that's it.
That's it. So I think there's a little message. We love to answer questions, but we'd like you to put your questions not in the chat. Please put them in the Q&A and we'll take a look. And I'm going to request to Dr. L that for our next talk show that we have little mugs that say clear your dermatology on them like they have.
I love that.
Yeah, the morning talk show. And it'd be really fun if we had a cosmetic talk show. Anyway,
Yes.
that's completely different. So go ahead and put your questions in the Q&A and we'll take a look to be able to answer them.
Amazing. Okay, so our lovely young technologically savvy friends are
They're pulling them
they're
up,
pulling them up.
so feel
Well,
free to go ahead.
actually, you know what? We have Allie here. Allie, do you want to talk a little bit about your experience
Yeah,
with the
sure.
Ultra
Mhm.
Clear? Okay, so I treated her with the Ultra Clear what, 10 days ago now?
10 days ago.
10 days ago.
Mhm.
Okay, guys, here we go while we're pulling these questions up.
Yeah, so I would say the treatment was very tolerable. If anything, it almost felt like getting your eyebrows threaded if you're familiar with that feeling, but nothing was really ever painful at any point. It was all very comfortable. The treatment went by super fast, and the downtime was not bad at all. Luckily, we had it done on a Friday, so I had the weekend as downtime just in case, but I felt comfortable after the first day going out, and of course, I was wearing my SPF and everything, but it really wasn't bad at all. I was very impressed and really excited. So it's awesome.
Thank you so much. And she had a light treatment. So if you recall. So here we go. How is this different from microneedling? That is a great question. So with microneedling, there's plain sort of old-fashioned microneedling without RF, and then there's microneedling with radio frequency. So in my opinion, this is dramatically more effective than microneedling. Now, if someone is just wants something quick, easy, they maybe don't want to do a laser, they are cost conscious, then I would recommend microneedling. In our practice, we use microneedling with radio frequency to sculpt certain areas like the lower face, the area under the neck, the jawline, around the eyes. So that's more of a sculpting technique in our office. Um, and it's just for an all over treatment, it's just going to be treatment for treatment dramatically more effective.
I would just add when we came back to this idea of the physics and the little channels, the channels for microneedling are really superficial. If you remember that little picture of this skin, it's in the superficial part of the skin. We can reach all the different levels of the skin through the ultra clear, and in the deeper levels we can have some increased changes, especially with collagen, even though microneedling can be effective. So I would echo what Dr. L said, that if you're looking for something that's a little more by way of outcome, this would be the better choice. I think the next question is super important.
Okay, the next question, do we need to avoid sun exposure before and after treatment with Ultra Clear? Absolutely. So this is basically the same restrictions as Fraxel, maybe even a touch more than Fraxel. This is a laser, and with almost all, I would say with all lasers, we need to be careful with the sun. So in general, and I don't care if you go here, elsewhere, anytime you have a laser done, you do not want to get sun before or after this treatment. How long and how strict depends on the type of laser, how strong the laser is. Since this is a very strong laser, we need to be very strict about this. The darker someone's skin is, the more careful we need to be. So if you have dark skin, the darker it is, the higher risk of laser is for you. And that's because the lasers tend to work very well in patients with dark skin. And also with dark skin, there tends to be a risk of hyperpigmentation. So basically, the more melanocytes or color cells you have in your body, the more likely they can release their pigment and you can get hyperpigmentation. So we always have to treat those melanocytes with respect. And yeah, so, but just like I said, in general, I would say 10 days before, 10 days after, similar to a Fraxel.
The next question is about driving yourself home. I'm pretty sure, and Allie, did you drive yourself home?
I did.
Okay.
Mhm.
And all the patients that we showed in this webinar that were our own, because I can't speak to what happened in the studies elsewhere, drove themselves home. You could have a unique situation. Again, we want to treat you as a unique individual. So I'm going to generalize and say usually yes. But if you have any specific concerns, we can talk to you about would you need some help driving home or not. But in general, I would say yes. Would you like to add on to that?
agree with that. And that's one of the great things about this. Some lasers, like when I used to do fractional CO2 laser, a lot of patients needed a Valium beforehand and they needed some more intensive pain management. And those patients obviously needed a ride. This laser, less pain, no pain pills, driving is totally fine. Okay, which treatment is necessary to treat the vertical lines around the mouth? So that would be the best results are going to be with the advanced treatment. We do this specialized technique called coring. So we do laser coring, which basically goes in and treats a larger area of skin in that particular area. And that's going to result in some dramatic skin tightening in that area, which would address those vertical lines around the mouth. Now, you will get a little bit of improvement with the other treatments, but if you are bothered by that area, I recommend that we do an advanced treatment. Now, sometimes, and this goes back to the customization, sometimes someone wants a light treatment everywhere, but like we did with Allie, there are a couple like little, very minor scars that we did aggressively in that area. So we can customize treatment and we have an add-on where you can add coring around the mouth for an additional cost, whereas you can do a light treatment everywhere else. For these promos, I would choose level 3 for the vertical lines.
And this next question is one of my favorites, and it comes up all the time. The question is about lifting with the collagen. So this becomes sort of a complicated question. As a surgeon, I commonly am asked to speak about what comes close to surgical results. And I'm putting together an international talk for March called Next Best Things Next, sneak preview. The next best thing for your neck, I truly believe, is UltraCore. But can it reposition? Can it actually move the structures in your face? No, unfortunately, your face is sort of bolted into place by some ligaments, which I spoke about in my facelifting webinar. But it can I love Dr. L's use of the term sculpting, smoothing, and certainly as the collagen tightens, the areas of the skin will definitely tighten. But is it actually going to change the positioning of your face? Unlikely. Do you want to comment about that?
I love what you just said, and I agree 100%. You will see some marketing out there, or you might hear other sources saying that there is true lifting. This is a surgeon talking who does facelifts, talking to you about lifting. And so you are getting the surgeon's perspective here. It is not going to lift your face like a facelift. Now, the reason people say lifting sometimes is because it can have the appearance of a mild lift, but that's more because of the sculpting nature and the skin tightening and the new collagen, etc. So can you go around the eyes to lift the eyelids? We sure can. So this is a laser and it does require eye shields to keep your eyes safe. So we put some numbing drops on your eyes and then we insert some eye shields. So they're like a little metal contact lens that goes over your eyeball. And then we can safely treat this area, the eyelid. That again will take that loose and very delicate skin and it just kind of like suctions it up and it tightens. And same thing with the lower eyelid. So it's very, very safe. It's very straightforward. And it will give you, it will kind of like, again, I'm not going to use the word lift, but because we're taking some of that loose skin and contracting it, it's going to make you look more alert, more awake. And what that means is younger. People's eyes look smaller as we age because the eyelids come down and the face comes down a little bit here. And so when the eyes have more show, we look younger, and that's what it's going to do.
I'm going to go on a careful limb here. And I often will say that if you have extra skin in an area, the only thing that can make that extra skin look better is surgery. I'm actually going to go on a limb as a surgeon and say, because of the special way that we can treat with UltraClear around the eyes, the well-established safety parameters for the eyes, you can actually tighten so you have a touch less redundant skin. That's pretty special, and I almost never say that. So I went on a limb with that because I think that that is also a very unique feature, is that again, the technology is well established in these areas.
I'm actually shocked she said that as a surgeon. She is extremely honest, and I think like your surgical views are really, really refreshing. It kind of brings us cosmetic dermatologists back to reality sometimes, in that these things are effective, they're safe, but they're not surgery. And so to say that we can get that improvement is saying a lot. I actually had my eyelids treated. Almost a year ago now, in March of last year, as part of my due diligence of this laser, which continued for an entire year before we purchased. And uh, it made a huge difference. So I had a single gentle treatment. So it was not a laser coring, it was a gentle treatment. And it made a huge, huge difference. I had so many compliments, and I have genetically heavy, droopy eyes. And for me, it just really made a huge difference for me, and I'm ready for another treatment.
So, how does this differ from CO2? That's a great question. CO2 and erbium YAG are kind of like cousins, and they're both attracted to water. So, erbium YAG is just a little more attracted to water. So, it has a little bit more of an effect, we believe, on the more superficial aspects of the skin. Dr. L can speak to that a little bit more. But they're very, very similar, actually. And I think I would just call them cousins.
I think that's great. In terms of sort of like what does this mean for you as a patient? We were very, very close to investing in a fractional, or sorry, a traditional ablative CO2 laser. Um, but the CO2 does have a little bit more of a risk of pigmentation loss. So that's one of the main side effects from ablative lasers, is rarely they can result in loss in all the color and give the skin this sort of like unnatural, they call it glass doll look, porcelain doll look. And the CO2 has a higher chance of that. So we like the erbium for its safety features.
And I want to comment on that. I've been begging Dr. L to please go down the route of erbium YAG mostly because of that. And I called it cosmetic Christmas when our when our laser came in. I put a big red bow on it because I was so excited. Again, CO2 because I've always practiced in very, very sunny areas. I just want to underscore the idea that I also agree that erbium YAG is going to have less of a risk of the pigment issues, and it is something that we take very seriously, practicing in a very sunny area. Um, I'm just going to go on to the next one, then you can comment
Yeah.
on it as well. The question is about the price. Is this price for one treatment or a package of three? I do think in the study, what Dr. L was referring to, they did do three treatments for everybody. A comment from your two favorite investigators as researchers. That's how that study was designed, but I don't necessarily think most people are going to need three treatments.
I agree. Yeah.
So we use those photos because they're widely available. Anybody can access them on the internet, and we just want to make sure you had reliable, like
Published.
published outcomes. However, I do think that, and you we can work with you again. It's individualized. The price is for one.
Mhm.
However, don't be swayed thinking, oh my goodness, for good outcome, I'm going to need three. That's really study design more than clinical reality.
Exactly. Thank you guys so much for attending. Sorry we went a little bit over. Oh, there's more.
There's tons of
All
questions.
right. Maybe we can address these like in an email, because
Well, maybe we can do a Q&A.
oh, we
We
could
can
do
have
a
a
Q
talk.
and
No, we'll
A.
keep all the, can we keep all the questions?
We'll keep the questions. Yeah, yeah, yeah.
Yeah, that would be
Copy and
kind of
paste.
fun. We can just do a quick little Q&A answer, maybe.
I love that. Okay, guys,
Okay.
we are gonna go because it's 1 o'clock and we're over. Sorry for the technical difficulties.
But come in and talk to us if you have questions.
Yeah,
That's what we're here for. Yeah.
consultation. We'd love to talk to you. Take advantage of the promo, please, because let me go back to that, because it's a great deal, and I think you're gonna love this this device. So thank you so much. Let us know if you have any additional questions.